Okay, so now we are on to the thoracic spine. So the thoracic spine consists of 12 vertebrae, and they form primarily a curve that is convex posteriorly. So I don't know how well you will see this, but I think you guys are all familiar with the convex posteriorly and what that means. Okay. So the difference with the thoracic spine is the spinous processes are longer and more prominent. They also overlap the next vertebral body, and we'll learn in another slide coming up that because of that, it limits the motion that's available in the thoracic area because of the overlapping of the spinous processes. The first 10 thoracic vertebrae have articular facets on each transverse process where they articulate with the ribs. So all the ribs except 11 and 12. 11 and 12 are classified as floating because they don't articulate with the transverse process of the thoracic spine. There's also the intervertebral and zygapophyseal joints, and those are basically have the same structure as the cervical region, which is awesome, so we don't have to relearn too many different things. The joint capsules are tighter than those in the cervical region, so again, you won't see as much motion. It's the cervical spine definitely allows for more motion than the thoracic spine does. And then the surfaces of the facets lie primarily in the frontal plane. And so because of that, you're going to see more lateral flexion and rotation in the thoracic spine than you would in the cervical spine. Okay, and then so again, in addition to the zygapophyseal and intervertebral joints that you will see in the thoracic spine, you're also going to see the costovertebral joints. So again, the costovertebral joints is the body of the thoracic vertebrae articulating with the rib. So it's composed of the convex superior and inferior demifacets on the head of the rib, with the concave facets on the vertebral body. And these are surrounded by thin fibrous capsule and posterior longitudinal ligaments. And then the costotransverse joints are the transverse processes of the vertebrae articulating with the rib. And they are composed of the convex costal tubercles of the ribs with the concave costal facets of the transverse processes. So for both the costovertebral joint and the costotransverse joint, it's going to be the rib surface that is convex and the vertebral surface or the thoracic surface that is concave. Whether it be the transverse process for the costotransverse joints or the thoracic vertebral body for the costovertebral joints. And then this is just another visualization for you to see the costovertebral joint and the costotransverse joint. Okay, so again, remember the costovertebral joints are going to be the body of the thoracic vertebrae articulating with the rib. And then with the costotransverse joint, it's going to be the transverse processes of the vertebrae on both sides articulating with the rib. Okay, and then again, remember it's the rib surface that's convex, the vertebral surface that is concave. So again, the movement that you're going to see at the zygapophyseal joints are going to be similar for what you saw in the cervical area. So the superior vertebrae is going to tilt forward or anteriorly on the adjacent vertebrae. And then at the zygapophyseal joints, you're going to see the inferior articular facets of the superior vertebrae sliding upward and anteriorly, and the superior articular facets of the inferior vertebrae. And then it's just going to be the opposite for extension. So that superior vertebrae is going to be tilting posteriorly on the adjacent vertebrae. And then at the zygapophyseal joints, it's the inferior articular facet of the top vertebrae going downward and posteriorly on the top facets of that bottom vertebrae. Okay, and then with lateral flexion to the right, you're going to have the right bottom facets of the top vertebrae gliding downward on the right superior facets of the intervertebral body, again on the side that is side bending 2. And on the opposite side, you're going to have the inferior facets of that top vertebrae going upward on the superior facets of the bottom vertebrae. So the same as what you saw in the cervical spine. So in general, the thoracic region is less flexible than the cervical spine, again, because we already talked about the fact that the spinous processes of the thoracic spine overlap the next vertebral body. It causes less movement in the thoracic spine. So I don't know if you can see this on here, but you can see how the thoracic vertebrae, the spinous processes overlap the next vertebral body, and you don't see that in the cervical area. You don't see the overlapping like you do in the thoracic area. There's also a tighter joint capsule, and the rib cage will also limit the motion, the available motion that you see in the thoracic spine. So the ligaments of the thoracic spine are similar to what we saw in the cervical spine. So you have the anterior longitudinal ligament that's going to limit extension of the spine and reinforces the anterior portion of the intervertebral discs in the vertebrae. The posterior longitudinal ligament is going to limit flexion of the spine. The interspinous ligaments are going to be between the spinous processes, and they're going to limit flexion and rotation of the thoracic spine. And then the supraspinous ligament is one that we didn't see in the cervical area. This connects the tips of the spinous processes, and this restricts flexion in the thoracic and lumbar spine. But you do not see the supraspinous ligaments in the cervical spine. And then the ligamentum flavum connects the lamina of one vertebrae to the lamina of the vertebrae above it. And again, this limits flexion and rotation of the spine. Okay, so that's the thoracic spine. And then the lumbar spine, as you all know, consists of 5 lumbar vertebrae. They're obviously much bigger than the thoracic and the cervical vertebrae because this allows for the lumbar spine to be able to support the weight of the trunk. The spinous processes are broad and thick and extend almost horizontally, so you don't see the overlap as you did in the thoracic spine. The 5th lumbar vertebrae differs from the other 4 vertebrae because it needs to articulate with the sacrum. Okay, so it's going to be the anterior height is greater than the posterior height, and the inferior articular facets of the 5th vertebrae are more widely spaced because, again, it's going to articulate with the sacrum. So the joints in the lumbar spine, again, are the intervertebral joints, just the same as what we saw in the cervical spine and the thoracic spine. So with flexion, that superior vertebrae is going to tilt and slide anteriorly. With extension, that top vertebrae is going to tilt and slide posteriorly. And then with lateral flexion, for example, lateral flexion to the right, that top vertebrae tilts and translates laterally on the adjacent vertebrae below. So with lateral flexion to the right, that top vertebrae is going to be tilting and translating to the right on the adjacent vertebrae below. Okay. All right. And then with the zygapophyseal joints in the lumbar spine, they are primarily going to line the sagittal plane, which will flavor, see, if I was in class with you guys right now, that would be funny. So they don't flavor, they favor flexion and extension, more than lateral flexion and rotation, as in which spine. So if we were in class right now, I would be having you guys go back to what we'd already learned and what spine favors more lateral flexion and rotation. And as smart as you guys are, you would say, well, Erin, that is the thoracic spine. So the lumbar spine is going to favor, not flavor, favor more flexion and extension more than lateral flexion and rotation, which we see more so in the thoracic area. So with flexion, again, you're still going to have that inferior articular facets of the top vertebrae going upward and anteriorly on the superior facets of the adjacent inferior vertebrae. And then with extension, you're going to have those bottom facets going, so the bottom facets are going to be going downward and posteriorly on the top facets of the adjacent bottom vertebrae. Then with lateral flexion to the right, you're going to have the right inferior facets sliding downward on the right superior facets of the adjacent vertebrae. And on the opposite side, so the opposite side that's not being side bended toward, you're going to have the left inferior facets of the superior vertebrae sliding upward on the left superior facets of the adjacent vertebrae. Okay, and then for the lumbar spine, the joint capsules are strong and the ligaments of the lumbar region are essentially the same as the thoracic region, except for an addition of the iliolumbar ligament and the thoracolumbar fascia. So for the iliolumbar ligament, it connects the posterior portion of the ilium to the transverse processes of L5. It functions to stabilize the lumbosacral joint and prevents anterior displacement, so forward movement. And then the thoracolumbar fascia is connected to the spinous processes of the lumbar vertebrae, the PSIS, and the iliac crest, and consists of 3 layers that separate the lumbar muscles into 3 different compartments. All right, and for the sacrum, this is the broad, thick bone that actually consists of 5 fused vertebrae. So it fixates the spinal column to the pelvis. You can see right over here. So it's attached to the pelvis by strong ligaments forming the sacroiliac joint. So there are 4 ligaments that you need to know. There's the interosseous sacroiliac ligament. This connects the sacrum and the ilium. It functions to resist anterior and inferior movements of the sacrum. Then you have the posterior sacroiliac ligament. This connects the PSIS with lateral portions of the 3rd and 4th sacral segments. So this pretty much limits all sacral motions, but especially the posterior rotation of the sacrum. And then the sacrospinous ligament connects the ischial spine to the lateral sacrum and coccyx. And this limits anterior rotation of the sacrum on the pelvis. And then the sacrotuberous ligament attaches to the PSIS, lateral sacrum, coccyx, and ischial tuberosity, and its function is to limit anterior rotation and superior translation of the sacrum. So after reading back through those, you can see that most of these ligaments are going to be limiting anterior motion of the sacrum, except for the sacrospinous ligament. Okay, so the sacrospinous ligament is more going to limit the posterior motion. I'm sorry, the posterior sacroiliac ligament is going to be what limits posterior motion of the sacrum. So just like in class, of course, I have to misspeak at least once, right? So I'm not going to retape this and do it over again because we're going to try to make this as much like class as we can. So again, what I was saying there is if you look at these ligaments, most of them are going to limit anterior motion of the sacrum, except for the posterior sacroiliac ligament, which is going to limit posterior motion of, or posterior rotation of the sacrum. All right. And of course, we need to talk about capsular patterns. Okay, so there are capsular patterns within the spine. So the cervical capsular pattern is lateral flexion and rotation are equally limited, more than extension. In the thoracic spine, the lateral flexion and rotation is equally limited more than extension. And in the lumbar spine, lateral flexion and rotation is equally limited more than extension. So obviously I'm sure you guys can see as much as I can that they are all the same. So if you can remember that lateral flexion and rotation are equally limited more than extension, then you can remember spine capsular patterns because it's going to be the same in the cervical, thoracic, and lumbar areas.